In our Health Watch, the American Cancer Society says a growing number of younger people are being diagnosed with advanced stages of colorectal cancer. CBS News' Michael George introduces us to a patient who was only 44 years old when she found out she had stage 4 colon cancer.
In December of 2021, Anna Canali noticed something wasn't right.
I was having discomfort, wasn't able to use the bathroom. I looked like I was 6 months pregnant.
She saw her doctor and scheduled a colonoscopy for the following month, the day after her 45th birthday.
I didn't even make it to that point because then I ended up in the emergency room.
At age 44, the Long Island mother of 3 was diagnosed with stage 4 colorectal cancer that had spread to her liver. A new report from the American Cancer Society anticipates 153,000 new colorectal cancer cases this year and about 52,000 deaths. 60% of new cases are advanced stage disease, and rates are increasing among younger people.
Shockingly, 1 in 5 people who will be diagnosed presently are younger than 55 years of age, which is quite young for colorectal cancer.
Doctors aren't sure what's driving that trend, but say more than half of colorectal cancers are attributed to factors under your control, like diet, exercise, and smoking. Doctors recommend knowing your risk and getting screened, ideally with a colonoscopy starting at age 45.
I don't remember what my life was like before cancer. This has become the new norm for me.
Canali says despite the rigors of her chemotherapy, she's living a full life with her family and staying positive.
I know that I'm going to be okay. I have that, I can see it, and I know that my positivity can help others.
Canali wants others to be aware of their bodies, and if they feel something, say something. Michael George, CBS News, New York.
Here now to discuss the study's findings is Dr. Arif Kamal. He's the Chief Patient Officer from the American Cancer Society. Dr. Kamal, good morning. Thanks for being with us.
Good morning.
So why are younger people getting colorectal cancer? What's causing this? Do we have any idea?
It's probably a combination of two things. One, as was mentioned, is lifestyle factors. We know there's a clear relationship between obesity, sedentary lifestyle, and smoking with an increased risk of colorectal cancer. The second thing to note is as there's an increased incidence of about 2% per year of colorectal cancer in people under 55, we also see a disturbing trend in low utilization of colonoscopy and colon cancer screening rate in those younger folks.
I'm going to actually ask you about that in just a second, but quickly though, what happens when younger people are diagnosed, and what is the prognosis, especially if the cancer, like the patient we just heard from a few moments ago, if the cancer is discovered at an advanced stage?
Yeah, it's better than it was 5 or 10 years ago. Long-term survival is about 60% versus 50% a decade ago. But it's important that they get access to, a multidisciplinary team of oncologists, gastroenterologists, surgeons, and radiation oncologists to put the best plan together.
Now, younger patients are less likely to get colonoscopies again, as we heard a few moments ago. Should younger patients be screened less invasively, or should these screenings start earlier? Or do we just have to tell people, look, you need to get a colonoscopy earlier than 50, which I think is the benchmark that most people are associated with? I know that's kind of been scaled back to 45, but does it need to even be earlier?
Well, we don't have enough evidence yet for going earlier than 45. My recommendation for people in their 20s, 30s, and early 40s is talk to your family and your doctor about what your risk is, because the guidelines are really for people at average risk. It's also important to remember that there are screening tests other than colonoscopy that may be better suited for people. For example, home-based stool tests. And so from our perspective, the best test is the one that gets done, and there are options, and people should talk to their doctors about that.
Well, I know some people get squeamish about getting colonoscopies. I'm speaking from experience. I had one about 3 weeks ago, and luckily the results came back great. But it is a painless process and something that you have to do now at 53. I was scheduled for my first right before I turned 50, but then the pandemic hit. That got put off.
Yep.
But again, a relief to get it done and a relief to get the results, of course. Now, with some, this can be embarrassing to talk about having colon cancer, getting colonoscopies. How do we get people to kind of overcome that discomfort that exists when talking about it?
Well, it's more common than people think, right? It's the 3rd most common cancer in both men and women, and overall in the United States, the 2nd most common cause of cancer and cancer death. And so, it's out there. Most people probably know a friend or neighbor or someone who has it. It's just sort of destigmatizing the concept of talking about it. And the more we talk about it, the more we'll get people to, get out there and support their friends in getting those colonoscopies done.
Yeah, and just real quickly before I let you go, disparities within certain groups, are some races or people more likely to get it than others?
Yeah, we see slightly higher rates in African Americans and Black Americans in the United States, and particularly very high rates in American Indians and Alaska Natives. And the reasons for that are complex, but an important area of research.
And just a final takeaway here, your advice for people when it comes to colon cancer and getting themselves screened.
If you're 45 or older, call your doctor today to get your colon cancer screening scheduled. It's as simple as that. Because remember, those tests are not only finding cancers early, but taking them out, the precancerous lesions, before they actually turn into cancer, which is exactly what we want people to do. And
that's exactly what happened with me when I had mine a couple of weeks ago. Dr. Arif Kamal, thank you so much. Our Chief Patient Officer from the American Cancer Society. We do thank you for being with us here this morning, and hopefully people take heed of this information. Ounce of prevention worth a pound of cure, right?
That's absolutely right.
All right, Doc. Thanks so much. We'll be right back right here on CBS News New York. Stay with us.